do you use single fiber EMG to differentiate presynaptic disorders from postsynaptic disorders?
Well, this is so much more easily done with repetitive nerve stimulation, and perhaps even a single shock after forceful voluntary contraction for some 50 seconds or less. So you present a shock first to the after rest and then after contraction, and the big difference in amplitude of the response will tell you that you have a presynaptic disorder. But we often do, just for mainly academic interest, this test of frequency, of changing stimulation rate in an end plate which shows a lot of abnormal jitter and blocking, or just abnormal jitter. And we usually use 10 Hertz as a baseline, and then go to 1 Hertz. We usually see a nice improvement in myasthenia, and then we switch over to 15 or 20 Hertz, and we see again slightly better or significantly better transmission compared to 10 Hertz. So this is a typical U-type curve, actually, described in repetitive nerve stimulation studies. And this is very nice to see, but it does not add very much to the diagnosis. When we go, for example, when we study, for example, a patient with rather malignant form of late myasthenia, late in life, then we often see improvement at low stimulation rates, but no improvement at higher stimulation rates. This is very often so. Well, in patients with Lambert-Eaton syndrome, we see the most pronounced abnormality at 2 Hertz, or even less than that. And then slight improvement at 5 Hertz, more improvement at 10 Hertz, and perhaps normalization of jitter and complete cessation of blocking at 30 or even 50 Hertz. This is a very typical behavior. And some end plates in myasthenic patients may behave partly in this way. So we do not use this as a part of our study in differentiation between the two types of disorder. But we must be aware that we have end plates with both types of behavior in one and the same patient with myasthenia.